Thank you for hitting play, and welcome to the series we're calling Data Pioneers. We're bringing together the brightest minds in the healthcare industry, supporting the transition to value-based care. We'll be highlighting the best practices, tools, lessons, and advice with a focus on data and analytics. I'm your host, Rich Waller from Wellstack, and we're very excited to have you join us today. All right, today we are here with Dr. Zafar Chaudry, Chief Digital and Information Officer at Seattle Children's. Dr. Chaudry, thank you so much for joining us today on Data Pioneers. We're honored to have you.
Thank you for having me. My pleasure to be here.
Excellent. I'm super excited to dive in today. I think there's just so many interesting things we're going to discuss. Before we get started, maybe just it would be great to get a little bit on your background, your experience in the healthcare industry, just to kind of set the table.
Yeah, so I've been in healthcare IT. This is year 38. I sort of started my journey as I consider myself to be a recovering physician, but a physician nonetheless. And I moved into technology in the early 90s when there was an opportunity in my organization to learn more about technology, and they wanted more clinician input into where technology was going. And I thought it would be a great opportunity to learn about the technology. And back then, things were more green screen. You memorized keys versus use the technology that we do today. And as I sort of got into that technology, I sort of evolved through listening, learning, and also realizing that technology would have a future impact in healthcare. And I've worked in CIO type roles now, in different parts of the world, 20 plus years in sort of leadership as well. And my journey has brought me, bouncing from the UK back here to the US. I've been at Seattle Children's now for 7 years as the Chief Digital and Information Officer.
Excellent. And you have some absolutely amazing accolades. Just reading through, 2022 Chime Transformational Leader of the Year, pretty much health system CIOs to know every year with Becker's, and then, number of HIM certifications that are quite impressive. You've been busy over the last the time you've been there.
Yeah, I'm grateful to be recognized, but truth be told, it is the teams that you have that make it possible.
Right.
And I've been blessed to have, wherever I've worked as a CIO, I've been blessed to have teams that are focused, energetic, innovative, and deliver great solutions for our clinicians and our patients. And on the back end of that is how I get recognized. So I appreciate the people that surround me.
Absolutely. Well, yeah. So, in terms of getting, I'm excited to kind of unpack this, 7-year or so journey with Seattle Children's. It'd be interesting to start off with, some of the highlights on the results, right? When you think about, leveraging data, improving outcomes, margin performance, what have been some of the key highlights that you all have tackled in terms of targets or ways that you're measuring value of some of these key initiatives?
So yeah, 7 years ago, which doesn't actually seem that long ago, I started my journey at Seattle Children's, inherited a health IT department that needed some work. We had a lot of technology debt. We were running our own data centers. Uptimes were variable, but in the low 90s. And there was a lot of equipment to replace. At the same time, the clinicians were not very happy with the services that were being provided. And, we started the journey by measuring our net promoter score with our clinical users, and it was minus 24 when we started this journey, which, I always say that when you start at that level, the only way is up. Right? So it was pretty rock bottom. And we're in the process of sort of repairing our technology infrastructure. So we did a big migration very early in my journey at Children's to a colo. So we closed down our data centers. We moved all of our applications. We have over 1,163 applications. We moved those to a colo, new infrastructure, new servers, new storage. And really the team worked hard to push the uptime higher. So, when we look at that journey, lots of work on infrastructure happened early. Then we looked at customer obsession. So I sort of view my clinicians, allied health professionals, as my internal customers, and I wanted them to have the best experience because I'm a true believer of if you're trying to balance innovation and what I would call lights on, doors open, you want to make sure the lights on, doors open is a wonderful experience whilst managing what innovation you have. There's no point in me telling you I've done all this innovation and I ask a doctor on the floor who tells me I can't get my laptop fixed because that's just a horrific experience. So we focused with the mantra of being obsessed about our customers. We did a lot of discussing with stakeholders. We did a lot of engagement with the caregivers that we have to try and build the best services. And in the process of doing that, our net promoter score is currently up to plus 44. So we've made a huge dent in people know if they call service desk, they get good service. If smoke comes out of their machine, the machine will be replaced at pace. So
Mm.
all the core basics, infrastructure, IT operations, service desk function, we sorted that early in the game. But at the same time, of course, you can't really run a team without doing some cool stuff, right? Because that's basically the stuff that you don't really care about, but you have to fix. So we did look at, well, how do we build this journey? And we started with our electronic medical records. So we were one of Cerner's earlier customers, had Cerner for 15 plus years. And one of the things we had probably not done well was to over customize the product. So much so that it wasn't really delivering the value that we thought. So I thought, what do we do? And I like to run my digital and IT strategies by not coming up with it myself, but asking the people who consume it as to what they need. So for an EMR, I went to clinicians. I asked for participation. We actually got 300 doctors and nurses participating, and they voted that they wanted to do Epic. So we embarked on an Epic project, but we decided we weren't going to customize it. We're going to keep the standard pediatric build. And all that happened, and guess what? The pandemic came. And that's probably when my deodorant failed because I was like, how do I deliver this in a pandemic when nobody is coming to site? But you can't delay projects like this because that adds cost, which is untenable for a not-for-profit. But thankfully, we were able to figure out the training. We were first to do 100% virtual training for our clinicians to get to go live, which we did in October 2020. So that was a huge win for us. And we've been measuring physician satisfaction with our EHR. And when we measured it with Cerner, that EHR satisfaction rating goes from a minus to a positive. So it was sort of minus 15. And we just most recently concluded our latest survey. We're up to plus 38 or so within that space. And so that means that the doctors are enjoying the use of the new system. What they are still facing, and that number has actually gone in the negative, is the physician burnout, which is real,
Mm.
right?
Yeah.
There's lots to do, lots of documentation to do, lots of patients to see. The pressures on the system are high. So physician, clinical, nursing burnout is still a problem for us, and it floats in the 46% range. So there's more work to be done there. The other thing we sort of thought about is, okay, so we've got good infrastructure, we've got a solid EMR. What do we do? What else do we need to take a look at in our portfolio stack, right? What innovations should we bring? And what's interesting about any health system is we as health systems, we sit on a multitude of data, which sometimes we do nothing with, right? So it's great to have 15, 20 years worth of really useful data. Not so great if you do nothing with it. So we, at the time when I started, we had a forward-thinking chief data officer. He worked really hard with his team to start building an initial stack, an initial warehouse of analytics, and that warehouse was built in our private cloud on IBM Netezza technology, and that allowed us to do basic reporting, Actually, we currently have 552 reports that we use in real time to run our organization. And he built that stack, and then unfortunately, he left us, and we were at a road of 5 years of working on analytics, and he brought in data scientists, and we were doing some really interesting things with those. But then we said, well, what do we do next, right? What is the next iteration? So, I'm pleased to say just in the last couple of months, the analytics team has gone to the level of moving their entire stack to GCP.
Hmm.
So we're a very big partner of GCP. All of our analytics stacks live in GCP, and we're now able to do things and exponentially grow as and when we want to, and our performance is improved. Whereas we were processing data in the evening, it would take 6 or 7 hours to do. Now we can do that in under an hour and then refresh all of our dashboards. But we've also thought about, what does predictive analytics look like? What's you wouldn't take me seriously if we didn't talk about a little bit about AI. What does that look like, right? And so we've been lucky enough to have some of the greatest data scientists who, very passionate about our mission, but also wanting to take a look at how we can take data and use that data to improve outcomes for our patients. So, we're very proud of the work we've done in the space of opioid usage in surgeries. So, what's really interesting about kids is when they come in for surgery, we use opioids to put them to sleep. And then when we send them home, they are actually impacted because we give them opioids for pain medication. And sometimes there's addiction. And addiction in teens is a problem, right? Especially with opioids, even adults. It's a major sort of national problem. So
Absolutely.
we started to look at our data, and we built tools within that data using our data scientists to figure out if we could model changes in clinical practice that would allow opioid-free surgery. And over time, as we exposed the data, we provided self-service tools to our clinicians. I'm happy to say that 98% of our outpatient surgeries are now opioid-free, and 50% of inpatient surgeries are opioid-free. And I think we've just completed our 60,000th surgery without opioids.
Wow.
And how that was possible was changing the medication, the anesthetic drugs to non-opioid, creating cocktails that would work, that would manage pain, but didn't have an addictive effect. And that's the power of using the data and then allowing your physicians to change how they do things themselves, right? So fundamentally, all our teams did was build the tools, but it's the clinical staff who saw their practice areas and were able to change. So these are some of the interesting things we do. We're collecting data from the bedside. So patients who have brain surgery have a high risk of stroke after that surgery. We're now able to collect all of the data from the bedside and use that data to help us predict the potential of a stroke and then take action so that that doesn't happen, because we don't want any patient to have a stroke. The side effects after that are absolutely massive. So we've done a lot of work in the analytics space. So that's all sort of culminated into, the badges you talked about. We're most wired. We have the HIMSS stage 7 in MRAM, AMAM, and all those sort of areas.
Yeah.
And so we've done a lot of work in collaboration with our caregivers. And I always tell you this, that I do not believe that I am in the business of technology. I am in the business of patients. And that's the mantra that I spend a lot of time telling my team about. And as we've moved from customer obsession and fixed some of our poorer SLAs and experiences, we've now moved into customer delight. So our future moving forwards is, now that we've built all the core basic building blocks and some innovation, what do we do next? With what we've evolved from is AI is not new. We've evolved from AI on small language models to generational AI on large language models. And we realized that generational AI would actually have a big impact on how we worked. So we've built a AI review board. We have an AI policy that's been ratified, and we're currently building a couple of use cases that will use a larger language model. If we take our data and we combine it with the data of other facilities that are similar to us, we will glean even more intelligence from that and take action that improves patient outcomes as well. And of course, as with every other health system, I'm sure we do some of the robotic process automation in the background that
Sure.
takes away some of the day-to-day work that isn't super exciting but has to be done. I truly don't believe, though, that Gen AI is completely going to replace people or even replace the physician. I think that's a misnomer. I think it's a parallel technology that allows us to work at a pace, uh, scale the work that we do, and get the subject matter experts focused on what they're good at, which is taking care of in our case, taking care of our kids.
Absolutely. I mean, a couple amazing points. I believe the opioid-free surgery. You all published a research paper on that, correct? I think I
Yes.
read that a little while ago. Really impressive stuff. Just the whole how the whole program came together. That was amazing. Like I said, I read that maybe a year or so ago. It's pretty amazing. And then with this much of a lot of really productive, I would say, kind of transitions, right, from both the EHR perspective and then also on the data stack perspective. It's pretty amazing that you all have been able to, through that transition to achieve the HIM stage 7 for analytics. You know, tell me a little bit about that process. Is that something that you found valuable for your team, for the organization? What was the process like of achieving the certification?
Yeah, I think, any certification you undertake takes work, right? Because you have to be able to articulate your story. You have to be able to demonstrate real world cases where
Hmm.
you've solved problems to an external group of assessors, because it's a pretty much an on-site typically assessment. I think it's exciting for the team to come together to celebrate what they don't think about on a
Right.
daily basis. And that's the forum for them to brag about the things that they've done. So yes, there's a lot of work behind it, but the gain is satisfaction that you've been measured and recognized to an industry standard. It also helps me because it allows me to showcase to the board of our organization what our capabilities are and how much improvement we have made, which helps when you're arguing for money, right? The reality is money's tight in healthcare, and people really only want to invest in support services, which is what we are, system services, if you can show value that you can bring in that particular function. And these type of badges help us show the board the value that we bring and that we're not saying it, it's actually measured and validated by an external party who is the subject matter expert in this space. So I think there is value in doing these exercises, but it does take work and it does take focus. And it's a culmination of many years of work by my teams to get there. It takes a multidisciplinary team to get to these type of badges. It's not one single individual. It's that and investment and future visioning that get you to where you need to be. And of course, these badges last for a couple of years and then they change the metrics and then we have to work harder. We have to be better. It's always about continuous improvement, right? If you sort of think about work that you do on a daily basis, what drives people? I'm not sure it's money that drives people. I think it's what new thing am I going to learn? What exciting thing am I going to do? If you're in a mission-based organization, how are you serving the people that you serve better with the things that you've learned and the capabilities that you've brought to the organization? So I think that's the exciting part of healthcare, even though healthcare goes through these cycles of, we're well funded, we're not well funded. and so on.
Yeah, I like the team building and kind of culture building aspect of that. The lens on the certifications. I think that's great for teams to come together and be able to kind of step back and showcase what they've done. I'm sure that's just great for camaraderie and those types of things, which is obviously mission critical as you're trying to work and retain top talent in any organization. Um, a lot of kind of what we do here on the series is try to share best practices, with leaders such as yourself for others, other leaders out there that are looking to pursue a similar journey. What guidance do you have for them in terms of how you plan this, governance, tidbits that would help them in their journey?
I think at the end of the day, this is a people business. And what you don't want to be is if you want to be a leader in this space, you need to be the person that is seen everywhere in your organization. You need to be out there, walking the floors, talking the talk, taking the blows, which you will get when not everybody is happy with what you do or what your team does. And you have to be open to accepting that feedback as well. So I would say that anybody who wants to grow in this field needs to be that individual, which isn't easy because, most people in technology are introverted. I would tell you that I'm the biggest introvert you'll ever meet, right? But most people say that that doesn't come across. And that's because my work persona allows me to go out there and ask the difficult questions and take the punches. So walking the floors, if you find yourself in your office all day, something's wrong in a health system because it's a people business. And working with caregivers, clinicians, nurses, doctors, allied health professionals, people working in other system services that you support. Those are the people you really need to talk to on a day-to-day basis to find out what they need, what they're happy with, what they're unhappy with, and what futures are they thinking about, right? Brainstorming sessions are great. And um, I love a whiteboard. A whiteboard with a marker is amazing because you can draw things out. I always say, what problem are we trying to solve?
Right.
Because people will have ideas, and there is this risky component of somebody going to an amazing conference and coming back with, oh, I need one of everything, but not really knowing what they're going to solve with that technology if they were to buy it. Sometimes the answer isn't technology. Sometimes the answer is, let's rework the process that you have in a department. Let's look at the workflow. Let's do those sort of things. And I think a person sitting in sort of a role as mine, it's not about how much technology you know. And don't get me wrong, I like the flashy lights as much as the next IT person, but it's about, can you communicate? Do you understand the business needs? Do you understand the finances of the business? Do you understand how care is delivered in an outpatient setting, in a inpatient setting, in a surgical setting? And if you understand that, then you can translate that back to your teams in terms of what tools, products, workflows have to happen. There is no harm in anybody in the seat of the CIO going and participating in what's happening on the front line. You know, don't shy away from asking one of your surgeons if you can stand in on a surgery and take a look. Now, of course, hopefully you're not queasy over blood, right? Because then you might pass out. But the reality is seeing what someone is doing in their field, especially in the surgical field, which generates revenue, it's a hard job to be a surgeon. If you're a transplant surgeon, you could be standing there for 10 hours doing a kidney transplant, right? And that's hard work. And you as an IT professional need to see that because you'll say you're working hard, and no doubt health IT professionals work hard and they work around the clock. But just imagine a life of a person who has to do two back-to-back lengthy surgeries. You have somebody's life in your hands. There's people outside the waiting room waiting for the news that it's all good. And you are ultimately responsible for that. So it is still a life business. And
Yeah.
everything we do in technology has an impact on that. So imagine if you don't have solid infrastructure. Imagine if you were watching a surgeon do a surgery and the lights go off. Imagine if the PCs go off. Imagine if the surgeon can't access the scan to finish the job because you don't have solid infrastructure supporting that. That could affect someone's life. And you, as an IT professional, would be responsible for that. And I think you don't see that reality until you actually go out and experience that. It's always easy to, be the backseat driver and be at home because we work remotely in tech mostly, and make claims about they don't understand us, and they don't fund us as well as they do, because it's always us versus them, right? But if you go out and see that, it makes a big impact. And I also tell my team that, on days when you are having a hard day, because we all do, right? We're all human. We have good days, we have bad days. If you're having a bad day and you don't truly know why work is piling on and why you're doing the work that you do, I always recommend go and spend time in the hospital. We're a children's hospital. When I go and sit in the hospital and I see children coming up to me with big smiles on their face, even though they have, three different tubes up their nose and in their arms and they're in pain. What I learned from that is children are hugely courageous. They will take their blows no matter how much pain they're in, and they will smile at their parents and they will smile at you. They are very resilient. And there's a lot to be said that you can take away from that. Plus, it also gets you refocused on why you chose to work in the field of pediatrics, right? Because it's all about kids, and kids need to be helped and defended against. We have to defend the kids. And so that's a good way of getting your compass back to true north. If your compass veers, and it happens to everyone. I mean, I'll be the first one to say I have good days and bad days, but I love going to the hospital and maybe, getting some of that courage to then go back and do the job another day and fight for what we're trying to achieve.
And how has your, background as a clinician, as a physician, shaped kind of, how you approach the industry? And I imagine it's pretty effective when working on engaging the clinical stakeholders, kind of having that background and that common understanding of certain concepts, right? And because a lot of us in tech that don't come from that background, what advice do you have, for us to kind of help bridge that gap, with clinical engagement?
Yeah, so I would say I have been at an advantage because going and talking to my clinical colleagues, when I'm new in a role, I don't actually tout the fact that I am also clinical. And I always get the pushback of, you wouldn't understand, how would you know? And then when they realize I am clinical and I've been there, then it does make the conversation easier. But it's not the be all end all. If you don't have a clinical background, you need to make more effort in understanding what the job function is, right? Because within a hospital, there's multiple specialties. The way in which a surgeon works versus the way in which an endocrinologist works, it's different, right? If you're in medicine, I'm internal medicine, and so that's different than doing brain surgery, for instance. So what I
Mm-hmm.
would say is to those folks that are not of a clinical background and are still heavily in health IT, they can overcome a lot of that by constant engagement, constant rounding, asking a lot of questions, and also becoming familiar with the terminology. There's no downside to learning medical terminology. You don't need a qualification in that. That's
Yeah.
a quick, well, in today's world, you could use an AI to teach you medical terminology. So that when people are talking about some of their pressures in various committee meetings, you understand. You understand what an appendectomy is versus a kidney transplant versus, acute lymphocytic leukemia, for example. You have to understand what the delta differences is. How sick is that patient really? How much pain is that patient really in? And what can we do in technology to assist in that space, right? We have chronic conditions, diabetes, um, sickle cell anemia
Yeah.
in kids, which is hugely painful. What can we do in technology to aid in that pain? We can use virtual reality to help in those sort of spaces. But if you don't understand what the illness is, You're never going to be the solutions providers because we are really solutions providers with our colleagues in clinical medicine. And our job is to provide solutions to help them do a better job, but also drive the best outcomes we can with the funding that we have to invest in that clinical care. So that's what I would highly suggest is take time, shadow someone. What I find is clinical staff are very good at agreeing to allow you to shadow them.
Yeah.
I know in my organization, if any one of my team said to any of the surgeons, could I, obviously with patient permission, could I observe a surgery? They would say yes. And they'd be kind enough to probably even talk through what they were doing so that you
Hmm.
would know, if you didn't have the background, what they were actually doing. But that has a huge impact on you. Seeing this stuff in action versus, being 10 steps away and, making big claims but not really knowing what it looks like. It's a very different environment to see someone bleeding versus know that you're never going to see that and you're detached from that. It makes it real,
Yeah.
right? This job is truly about your compassion to do the work, and it's not always easy work
Absolutely.
because even in the analytics space, if you are working on data that results in showing that patients may die, that has an impact on you.
Absolutely. Yeah. I mean, really, really great stuff. I mean, that's just awesome work that you all are doing. Um, shifting gears a little bit, we talk a lot on this series about value-based care and kind of the transition to value-based care in the United States. And, I'm curious, having come from, the NHS and the UK, I mean, you must have a pretty great, kind of experience and insight on the differences of a system that is based on, value and then where we are. So what thoughts do you have, or, kind of, how are we doing in our transition, or, how could we accelerate to more of a value based system in your mind?
So, look, I've worked in different health systems around the world, and what I can tell you is healthcare is the same, it's funded differently.
Yeah.
And a lot of this is about, how are you going to keep the patient well? So no system's perfect. The
Yeah.
NHS isn't perfect, has its problems, the Canadian system, etc., and ours as well. What I have learned though is prevention is always better than cure, and spending money in primary care and treating people at the first sign of any problem keeps them out of the emergency room. And what we've got to start to reconcile in our health system, the US health system, is we are sort of incentivized on illness versus wellness, right? So, for example, if you do go to an emergency room as an adult, the bill's really high. And if you were just treated as an outpatient by a primary care doctor, you really wouldn't generate a lot of revenue.
Mm.
The other thing we've got to focus on is providing enough clinical training to encourage people to go into those fields, i.e., primary care, family medicine, internal medicine, right? Because they're not always best served financially, and becoming a physician or a nurse is an expensive endeavor. So where I've seen success in the NHS is they have programs to fund training in nursing and medicine. And that means that when you graduate, you don't have massive amounts of debt, which means you can go into taking care of families, being a family practitioner, or as they call them, general practitioners. And general practitioners in the UK do learn specialty care. So you can be a general practitioner with a specialty in pediatrics. And then you'll treat a lot of the cases in your practice. And I'll give you the example of my own general practitioner back in the UK, who's still my general practitioner, by the way. And I've been his patient since I was a kid. So every time I go home and I go to see him, he remembers me and he knows me and he's sort of trying to treat me from cradle to grave, right? So you get a lot better experience than when I go and see a primary care person here because they don't necessarily know me because I pick them from a list and that list might change.
Hmm.
So I'm a true believer in if you can provide primary care services in the right spots in any city, and let's say it was at no cost, you would really drive up outcomes and reduce the number of people attending hospital in an emergency when they didn't need to. I mean, isn't the dream of healthcare be being you never have to go to hospital? I mean, I sort of think a health system's goal should be to not be in business because people are now well,
Right.
right? But
Yeah.
you don't sort of, that doesn't translate, this is controversial, right? Because that doesn't translate to margins. It
Yeah.
doesn't translate to profitability. But I would love to see a world where there aren't any pediatric hospitals because kids are just well,
Yeah.
right? We've just figured out how to take care of them and they don't have to have emergency sessions or, you know, difficult surgeries because they are well. But I think we're far from that. I think what we can learn from other health systems is how do you expand that wellness? Value-based care, you see this around the country. We also have some value-based programs. It's still incentivized a little too much, in my opinion, on cash,
Mm.
right? Because it's better for the health system if they can keep you well and then you get some cash incentive to do so. Maybe we need to change the focus to it's the right thing to do
Right.
to keep people well because you don't, I mean, I don't wish, I have lots of friends with young kids. I do not wish to see any of their kids ill for any reason. I would rather we figure out a way to keep them out of hospital than in hospital. Challenge will that be is if we don't have patients, then that will affect, our revenue. But I don't think I particularly care. I think I would rather be in a world, and maybe that's nirvana, but that's what we need to strive towards. How do we use this technology? How do we use the power of what we have? I mean, sometimes we undersell ourselves. The US healthcare system's got so much power.
Yeah.
Maybe we should figure out a way to use that power, use the intelligent people we have, use the technology we have because we're leaders in technology in the world, and find a way to keep people just well.
Absolutely. And we've talked about a number of really exciting initiatives you all are doing. What's next? What are you looking to tackle next as we look into the future?
Well, one of the things we looked at is, well, what are the core systems a hospital should have to do their work well? So we tackled the EMR situation. The other situation we had was our ERP, which is, finance, supply chain, human capital management, all those things that are really important as well.
Yeah.
So we've been implementing, we had Info for many, many, many years, and we've implemented Workday in two phases. So phase one actually just went live about a month ago successfully and to budget and time. And now we're moving into phase two. So the next big program of work for us is to implement the second phase of Workday, which will be finance and supply chain. We've successfully done human capital management and payroll, and we've successfully paid people correctly, which is a very good thing in today's world because nobody wants to be paid incorrectly. So I get to keep my job for a little bit longer. And we're going to be working on phase two. So that's a big transformation project because not only do we want to build in new technology, but we want to make sure that we're not over customized it and we standardized a lot of the processes in our supply chain and finance. And so that's going to take a lot of effort from a lot of departments and a lot of different people, not just IT. So that's what we're going to hugely focus on. The other thing that we just launched a couple of weeks ago is a new high performance computing platform for our research institute. It's all built on NVIDIA GPU chips, and it's probably one of the highest performing now in the country from what pediatrics has in research HPC. So we just launched that just a couple of weeks ago, and that's exciting because now our researchers can do next level research and have the compute power that will blow your mind. That's what
Yeah.
we want to do. So we've just done that. So we'll try to continue to evolve that as we're just rolling it out now to our research base. So that's exciting work for us. So, lots of things. And, the let's talk about the swear word in health IT, and that is cost improvement programs. So unfortunately, every health system has to have cost improvement programs. So do we. So the other thing we're focusing on is how do we continue to optimize our budget, optimize our spend in technology. And, we're sort of trying to reduce that by another 7 or 8% as our new fiscal year starts. So there'll be a lot of work on application rationalization, contract management, deprecating any technologies we really don't need that we've duplicated, et cetera, et cetera. So that's the non-fun part of doing this work is, who wants to wake up every day and do cost improvement, but it's a dark art that you have to practice.
Absolutely. And going back to the research, that's a really exciting initiative. Are there some specific areas of research that you're looking to target with that new computing power right out of the gate?
Yeah, so we have, researchers in every area from cystic fibrosis to infectious disease. I know some of our teams are working on the next generation malaria vaccine, which could impact a large percentage of the world. We did work on some of the COVID vaccine stuff as well in partnership with many other organizations. And our value proposition over the years has been a focus on curing cancer
Hmm.
with CAR T cell therapy. So we have a lot of good researchers that hold patents in that space. And the goal is to how do we program the human T cell to go into your body, take it out of your body, program it, and send it back into your body to cure certain types of cancer. So we've had success with some forms of cancer already, but we want to be able to do that for any cancer. So that's a huge focus for our research institute as well. And the other thing that we're very passionate about at Seattle Children's is equity, diversity, and inclusion. We want to be able to build solutions and cures for our entire population in an inclusive way. And we've actually built EDI as a pillar in our strategic plan. So we're doing lots of work around normalizing care by
Hmm.
age, by sex, by race, and lots of smart people are working on that as well. Um, so all different kinds of research is happening. It's a fun place to be. And over the years, we hold patents in different technologies or different research pieces that we've delivered actual care on. And that will definitely continue because the mission of Seattle Children's is hope, care, and cure so that our kiddos can live the most fulfilling lives. And I think that when we look at a child and their life, it's not just helping them when they're ill, but helping them through all facets of their development and growth. So we're very passionate about that. And part of our program around EDI, certainly in IT, is how can I help the next generation of kids be successful in their careers? Because if they are successful in their careers, they will have a place to live, they will eat correctly, and therefore get less sick. So we have a program in place with the City Colleges of Seattle where we in IT at Seattle Children's provide scholarships for students who come from underprivileged backgrounds, high school, directly from high school, so they can go to college and get certificates and degrees in health information technology. And my department pays for those scholarships and afterwards it even employs those students so that we can build a pipeline of talent, but also help the community get training and education which they might not have access to. Because you and I both know that college education in the US isn't cheap.
No. Yeah.
So, if I've got a family that's not very well off, the likelihood of me getting to college is slim. So I wanted to sort of level that playing field a little bit. And so we've done that. We've been doing this for 3 years now, and we've had cohorts of students come in, be successful, get jobs in the field in health IT, and that's super satisfying. So that also satisfies our strategy uh, of focusing on that inclusion and equity.
Yeah, that's truly amazing stuff. I mean, it's such a with also just having such a staffing and resource shortage in some of these key areas. Leveraging, you know, those groups coming up even within your own community. That's really great stuff. I mean, really rewarding work. Um, Amazing. When what we like to, part of what we do on this is, create a kind of collaborative environment, right? For all of us who are looking to, continually educate and things like that. So what resources do you go to for, information, research, staying up on the industry, kind of books, periodicals, conferences? What's your strategy?
Well, I think the usual suspects definitely attending health IT conferences where you can network with your peers is hugely valuable to me. So I do go to the standard hymns, chime, those sort of events. I think it's important for somebody in my role to also consistently take vendor briefings so that you can learn about new technology and their roadmaps. And I learned that when I was working at Gartner, right? I worked at Gartner as well on the super dark side, as some may say. And I learned that the partnership between your own customers as well as the vendors that actually provide you with solutions is valuable. So you have to build that relationship as well. And learning where a chip company is going or a tech company is going informs you. And of course, you take it with a pinch of salt because they're trying to tell you they're the best at what they do. But you do learn about what technologies are coming, what they're thinking about. So I would actively encourage that. I would actively encourage networking with your peers. You know, I encourage people reaching out to me and we can have a great conversation and a laugh about what's good and what's bad and what's ugly. And we can do that in behind closed doors and share that knowledge. You've got to be able to share the knowledge,
Right.
right? How do you multiply the mission is what I sort of think about, right? I don't profess to know anything about anything, truth be told. I am just treading water as I'm learning along the way to try and get to a positive outcome for my organization for the services that we provide. And when I get stuck, I lean on friends, peers at the same level as me or higher level than me, and try to learn from them when I'm scratching my head, not knowing how I could potentially do something. So networking is hugely important for leaders in health IT, not only with vendors, but also with peers. I think that's important. I'm not really a book person. I'm more of I mean, it's not that I don't like books, it's that I'm more interested in listening to a book than reading it. Just
Sure.
because I absorb information faster if I hear it versus reading it. And obviously, over the years, I don't have the best of eyesight either. So I do consume audiobooks. And I also like there's a couple of services where they will provide you audio summaries of the
Mm,
best books.
right.
So if you're trying to absorb information on pace and you don't have a lot of time, which I certainly don't, I'm good with the Cliff Notes version of the best selling books. Just give me the key principles that I can potentially apply to my work. And listening to that when you're sitting in, you know, bumper to bumper traffic is easy to consume.
Yeah.
And the subscriptions are relatively inexpensive versus, I have to go out and buy 100 books
Absolutely.
versus
Yeah.
consuming, 10 summaries in a month, which will only take up, 40, 45 minutes of your time is where I found real value.
Absolutely. That's great. Um, what's the best way? I mean, we talked about a lot of really exciting initiatives that you guys are tackling. What's the best way for us and other leaders listening to continue to follow your work?
I actively encourage anyone who's listening to this to reach out. They always say reach out and touch someone, right? So we're still humans and we need interaction. if you want to have a conversation about something, reach out. I'm very good at answering emails. My email address is freely available. Let's talk. If we're
Right.
local, let's meet, right? Even if it's in a group. I think the conversational piece is something we are starting to lack, right? In the world of technology, when anytime you're traveling somewhere or you're sitting on a boat or a plane or a train, people aren't talking anymore. They're buried in their screens, thinking somehow they're going to glean all this knowledge. And I would argue that a 5 minute conversation with someone is very enlightening.
Absolutely.
Here we are, we're having this conversation. It's great to talk to you because I've never met you before. And you're asking me questions which, you know, probably it's great we're not in the same room because my deodorant's probably failed. But the reality is, you're asking me these questions and it's getting me to think, right? So I would actively say, yes, I have a strong presence on LinkedIn. I don't have a strong social media presence because I'm pretty business centric, and it's very important that leaders in the healthcare space not get involved in politics of
Sure.
social media, right? Because the reality is, I truly respect everybody's opinion, personal opinions they have. But when you're the face of an organization, you have to be very careful how that comes across. LinkedIn's a great place to network. It's a great place to publish things you've seen or heard of or what your team is doing that somebody could benefit from. So that's another place I would actively say have a look. But yeah, reach out. Let's have a conversation. If I can help someone, that would be my pleasure, right? And I would hope that if I could learn something, that would be great for me too. Because you always learn something from a conversation, right?
Absolutely. Well, I'm definitely going to take you up on the offer next time I'm up in Seattle. I'd love to continue the
Yeah, please.
conversation. This has been fantastic. Dr. Chowdhury, sincere thanks for being on with us today. This was fantastic, and really appreciate the time.
And thank you. I mean, thank you for thinking of me and having me on your show. It's been a pleasure to have a chat with you. So thanks a lot.
Excellent. Thanks again.